And we are live with Direct Line.
Hello, how are you? And welcome for Direct Line. And I'm Mark Unkefer, and I'm here with Jackie Sackstein. Jackie?
Hi, everybody. So we are delighted to have the brand new chair of the Black Republican Caucus. We have Nicole Bennett. Nicole, how are you doing?
Hi, how are you? I'm good.
We're so happy to have you. So first of all, congratulations.
Thank you very much. I'm very excited to get started.
Yeah. What are you most looking forward to? What are you hoping to accomplish?
So my first and second goal is to grow the membership. There are lots of minority people who want to get involved with the party. And I think in some circumstances, while we have good messaging, sometimes it is actually the messenger. I can be helpful there. Our group can be helpful there. We can kind of speak a different language and present it in a way that's a little bit more palatable, I guess, to prospective GOP members. I'm really excited. There are lots and lots of people to talk to, and we're anxious to get out, knock some doors, and shake some hands.
Yeah, absolutely.
So tell us a little bit about what the BRC has been doing and what you kind of events and activities you'll be doing in the future.
So the BRC is a really dynamic organization, and it's made up of very accomplished Black Republicans. We have the first and the second vice chair of the state party that are participating. Shannon Wright, who's running for mayor of Baltimore. Dolores Reyes, who is, a ball of energy.
She is a force to be reckoned with in Montgomery County.
She's a force to be reckoned with in this state. Let me tell you.
Montgomery County as well. Yes.
You're not going to sell her short. Let me tell you.
No, I'm not. Sorry.
Really dynamic. My vice chair, Keena McKenzie, is so energetic, and she brings out of Baltimore City. She brings this energy. I also serve as the chairman down here in Charles County of the Republican Central Committee, but this particular group has a different kind of synergy. I mean, we kind of feed off of each other, so it's really exciting to work with people. We have one sole focus is to get Black Republicans elected. Second focus, to increase our membership and leave a legacy for people who want to join the party, who may need the BRC as a bridge to the regular MDGOP. I mean, if you've ever been someone who's new to an organization, you really do sometimes need someone to kind of show you the ropes and walk you through more of an orientation type thing. Yes.
Yeah, and I would say, you guys' mission is more important than ever. I've been saying for a while, and I'm on the board of the YRs, is, we need to work with the BRC. I said, I think the way that we solve the whole issue with police reform and everything is finding strong Black Republican voices and getting them elected into positions. And I think that that's how we really make change that's going to be beneficial.
I'm so super excited to hear you say that. The YRs have been just tremendous force in Maryland politics. You guys have really kind of set the bar really high for other organizations. I am lucky enough to be friends with Maria Sophia, who is phenomenal. But she really has this way of talking to people that makes you feel instantly connected to her. Yeah. So I like to take little pieces of people that I hold dear, things I want to emulate. And from Maria, she kind of wraps you in this like warm cocoon and says, don't you really want to run for something or volunteer to help, So when she does that, you're like, oh, sure. It's kind of hypnotized. I want that skill. That's a superpower. And I'm all in for that. It would definitely come in handy with the BRC. But I have members who do that. Brandon Cooper is so tremendous in the way that he can relate to people where they are. We don't require that people stretch up to meet us or that we have to stoop down to meet people. We meet people where they are. And luckily for us, Republican tenets match up 1-to-1 with what African community wants. Really and truly, we want better schools. We want school choice. I should have a choice in where I send my child to be educated. We want lower taxes. We work hard. We want to keep the lion's share of our money. And I don't think there's one person in Maryland who can argue the fact that our taxes are way too high. 100%. At this point, you would have to literally be living under a rock to think that our taxes are fair. There are so many things that are going on that I think the BRC can put our mark on and be helpful to the MDGOP family. And that's really what we want to do.
Now, one of your former chairmen, Shannon Wright, who's also the former chairman she's still chairman in Baltimore City.
Yes.
I'm sorry, I just disposed her without. She's obviously running for mayor, and that's really been a cornerstone of her campaign. Has been this message of empowerment. So you're probably closer to how that's been going. How is that going for her?
I think she's really turning a corner with it. You know, it's hard when it seems like the field is so large. Do you know what I mean? And then in comes this pandemic, and you can't knock on doors, and you can't do this, and you can't do that. But I think there are so many people across the state, and this is the beauty of the BRC. We have BRC members across the state, literally, where we can help her spread her message, not necessarily to people who can't vote for her, but listen, the more people who listen to her message, the easier it is for people who are in Baltimore going, you know, I have an aunt that lives down in Charles, and she said that you were down there and you gave a speech to the Central Committee, and it was, you know, really good. Tell me more about it. I think she's really gaining a lot of momentum. Being empowered in a place where people are not expecting you to be powerful can be a benefit. You know, when people think of Black people who live in Baltimore City, they don't think affluent, they don't think college educated. Those are probably few and far in between when people think about the particular demographic. But the reality is they're Marylanders, and they want the same things that we want. Everybody wants to do better. Prior to COVID, the economy was booming. More Black people were working than ever before. You know, we had so many things to be proud about and hang our hats on. And that kind of empowerment, not the false kind that comes from social programs and that type of thing. Ronald Reagan had it right when he said the best social program is a job. Men need purpose, without question. And I think she rings that bell for a lot of people. And she has a very honest demeanor. And she really does call it what it is. So you don't get any of this, you know, double talk or that kind of thing with her. I think she's going to do much, much better now that people are getting out a little bit more than they were earlier on in the campaign.
Now that there's a kind of a clearer choice to be taken. Now, how has BRC been working with the Trump campaign? Have they been supportive?
Absolutely. So we're actually having an event with them tomorrow evening, a mega event, and it's going to be really fun. We have Reverend Dean Nelson from the Frederick Douglass Foundation, who's going to be participating and speaking at this event. We have Deontay Johnson from BCF. He also does Blacks for Trump, maybe for Maryland or Virginia. I'm not sure which one, but we're really trying to engage with that because, you know, Maryland, as much as I'd like to call us a battleground state, is disingenuous. It's just, you know, we're not going to win Maryland for Trump. We're just not. But the BRC is helpful in other states, battleground states, and other races that can be helpful to the president in that way. I know we're planning to do a little something in Pennsylvania to go up and knock some doors and help there. But this MAGA event should be, you know, a bunch of fun for everybody. And we've been looking forward to it. It's hard when you've kind of been living for an election cycle, especially a presidential election cycle. We haven't had any of the fun that goes along with the election cycle. Do you know what I mean? Like getting out, shaking hands, meeting people, having events. So it's a little bit difficult. It's required us to think outside the box. But this particular event came along kind of suddenly, but it's like manna from heaven. And we're like, finally something we can do, you know, to help President Trump. So Kevin Daniels from the RNC, he's the director of African American engagement, is going to be one of the speakers as well. So this should be really dynamic. And it is tomorrow evening from 6 to 7. And if you want to go, because we can't, you know, put it out there publicly as far as posting on Facebook or that kind of thing, you can just reach out to us at info@mdblackrepublicans.com. We're happy to help.
That sounds great. Now, you mentioned the importance of education as an issue, and I know we've in Charles County, as the Charles County Republican chair, your Central Committee has been really focused on that, and also specifically on the Board of Education.
Yes.
Races.
So for us, because the demographics are really against us here in Charles County, I think the last time that they checked was July. We had almost 25,000 registered Republicans here to 71,000, almost 72,000 registered Democrats here. Not as grave as it sounds. I believe that some of these Democrats are what we like to call blue dog Democrats. They're Democrat name only, but very conservative in the way that they live their lives. We are getting a lot of success in unaffiliated races. We were successful in getting David Hancock on the Board of Education and a couple of other Republicans. But David's race stands out to me because right before the election, they were kind of, I guess, outed by our local Democrat Central Committee they put out a list of people who were invited to come and speak and said, but no Republicans. So by association, if you weren't on that list, you were like, oh, I didn't know he was a Republican. But he kind of embraced that. And he said, yes, I'm a Republican. I'm a conservative person. My wife works for the school board. I'm still the same Dave that, you know, feeds the cows that you eat from my farm, from my store. You know what I mean? He's still our guy. And the county really rallied around him, and he did really well. And he stuck to his guns about being a Republican. He didn't hide it. So we're looking forward to add on to that. So we have some very conservative African-American people who are looking to run. And man, I can't wait to put them on the ballot. I'm so excited. Super excited about that.
Definitely gonna have to keep us updated on that. We're really interested to see how that rolls out.
It's going to be really I think it's probably going to be one of the more fun campaign cycles we've had in a long time. I really like getting out and talking to people. It's my thing. Even on election day, we were out in primary day and just kind of talking to people waiting in line, because Charles County had these wickedly long lines of people just standing out in the heat waiting to vote, So it was really nice just to talk to people who I ordinarily wouldn't meet, because I work very far away and live in Charles County. So by the time I get home, it's dark and that kind of thing. But I was really taken aback by some of the things that I heard from people who were waiting to vote. And some of those things were, they don't feel like their voices are being heard by our current leadership. They feel like they're being dismissed. Their concerns are being dismissed. And I'm like, hey, I'm here. I'm all ears. Tell me what you want so I can go out and find a person who can do it, and let's get them elected. So I'm very excited about what the future holds for Charles.
Yeah, I mean, that's all anybody wants, right? It's from their representatives, is to be heard.
Yeah. We had a couple of really interesting incidents here, say over the course of the last year, where I think our local power structure was really kind of shaken. Believe it or not, there was a gentleman who wanted to open a strip club, for lack of a better word, here in my town, Little Sleepy Brian's Road. Our claim to fame is a 24-hour McDonald's. And I think that actually closes at 11. But it's a sleepy town. We roll up the rugs tight around 9:30, and lots of federal workers who live in this area. So we get up really early and make that commute. But he wanted to use an old restaurant and turn it into a strip club. So, people were like, we don't want it in our neighborhood. It's 3 churches on one side and a school on the other. This is the worst place in the world for a strip club. And, our county commissioners were like, well, we have to see the permit. People turned up at this community meeting. It was so packed at our fire hall. You couldn't even get in. Like, people were in the parking lot, and there were little old ladies screaming at the top of their lungs, railing, going, I voted you in this office and I'll vote you out. And our power structure was like, are you talking to me? And they were like, I voted you in. So it was really an eye-opening experience for them. And they've been a little bit more receptive, but I don't think they're at capacity as far as listening to the community's needs yet.
Yeah. Hey, nothing rallies people much like anger and outrage.
For sure.
We were talking before about Charles County, and it really has been evolving as a county. And it's how would you describe it these days?
Charles County is getting more and more metropolitan. And you think of Charles County, the last thing you think of is urban. Is not our look. But Waldorf purposely has been built to be a little bit more populous than the rest of the county. So we have, over the last decade, our demographics have changed significantly. And right now we're 51% Black, which is very new for Charles County. 50% of the homes are led by women. So, go girls. And our median income is now up to $95,000, which is tremendous compared to where we were 10 years ago.
Say there's a good single male population out there.
If you see some, send them our way, Jackie. I'll meet them at the PG, border. I'll bring them on down, right? I think my personal belief is that as women have entered the workforce and have earned advanced degrees, because our populace is much more educated now than it was even 10 years ago, with more people holding advanced degrees. I think that we look for safer places to live, safer places to raise our children, and Charles County represents that, while still being close enough to Prince George's in Washington, D.C., where your drive is only 45 minutes instead of an hour and a half or 2 hours. So with that has come some challenges for the Republican Party. And I think our community, it's really kind of the tale of two Charles counties, where we have people in Waldorf who are very progressive, and they want restaurants and like clubs and that kind of thing, and sleepy Charles County, where we just want vegetables to be on sale at the farmers markets. It's definitely a dichotomy. And although I wish I could say everyone's getting along really well, it's not been working out that way. But I'm very hopeful for the future. And we're trying to do some things community-wise to have some leaders meet. I actually did a radio show with Derek Terry. He's a prominent local Democrat. It's called I'm Not Complaining, I'm Just Saying. And he wanted to talk to me about being a Black Republican. I said, that's great, because I want to talk to you about being a Black Democrat. So it was a great show. His wife says the best show he's ever done, right? So we had a really good talk about, what it means to be a Black Marylander. Maryland is one of those special states where if you apply yourself, you can make a bunch of money. I mean, you can really amass some wealth. And I don't think that whether you're Black or white or Chinese or what have you, I think the American way is to amass wealth. I think we all share that thing of wanting to be successful and having nice things and all of the fruits that come from hard work. But where we diverge is it just the individual? Or do I have to bring the group with me? Can I just excel on my own and be really good in my community? Or do I have to wait for the group to catch up with me and we all take a step forward? And of course, I believe in individual freedom and success and American excellence, right? And I believe he believes those things too, but in a smaller sense. So it was a really interesting conversation. And I think he came away with more respect for our party than he went into it with.
That's all we can hope for.
Right.
I've always said I never enter a political conversation to change somebody's mind, because then it's a futile attempt, but just with an attempt to understand.
I think a lot of those conversations, you really realize that there are points of intersection in which you do have common ground, and it's an opportunity to capitalize on that. Sorry, I interrupted you. You were going to say.
Oh, no, you're just fine. My thing with some of my friends, I have some dear friends that are very politically active Democrats, and some of them older. And, when I talk to them about what they think it means to be a Democrat and what they hold dear, and I tell them what it means to be a Republican and what we hold dear, you're right, Mark. There are lots of places of intersection. And instead of focusing on the things that we have in common for the greater good, we have these fringe elements who are saying, well, no, you don't like Trump, so, we have to be mortal enemies. It doesn't work that way. Charles County is a small place. It really is. And a very closed community in a lot of respects, like most of Southern Maryland. Southern Marylanders like to stay in Southern Maryland. We don't like to travel about and be in other parts of the state. We've got to get along better for the common good. I mean, absolutely for the common good. We have more children living in our community now than ever before. Our community has gotten much younger in the last 10 years. It's interesting because the kids are pretty much open to anything. And I think that's more of a testament to the power of the internet and them being able to kind of explore things that ordinarily maybe 20 years ago you would have to ask your parents or read in a newspaper that may have a slant, either Democrat or Republican. So I think they're a little bit more open to being unaffiliated voters. We've got about 20,000 of those people who are unaffiliated. So this particular term, one of my goals has been to turn some of those unaffiliated to affiliated. Like, pick a party. Come on.
Right.
Give me a shot. What's the worst thing that can happen?
We might have to hook you up with Ryan Nidak and talk about getting you guys a TARS chapter down there.
You know what? I'd love to have it. Absolutely love to have it. We've been working so hard to kind of energize the people here. People think of Black Republicans and they say, oh, there's one of you. Like, the one guy called me a unicorn. He's like, you're a unicorn. I was like, me? I felt pretty fancy. And I'm like, not a unicorn. There's a whole bunch of me.
Right.
There's a whole group of me all over the state. And a lot here in Charles, but they just don't want to be active in party politics. They say, oh, well, when things calm down, call me. It's like, it's politics. It's never going to be calm. That's the fun of it. If it were calm, I wouldn't want to do it. You have to be sort of an adrenaline junkie to kind of participate in this in an active kind of way. Most people don't want it.
You got to get them in on the social, and then you work the Maria Sophia magic, and then get them
I'm
involved.
trying to get that superpower together. Maria's just so good with it.
She
She's
said, no,
super
it's
great.
just a happy hour, and then you sneak the door knocking in there.
I'm thinking about that. I'm thinking about having like a speakeasy kind of secret knock on the door party as soon as we're set free, which sounds
Well,
terrible in 2020, but as soon as we're free, right? Let my people
So,
go.
so what's happening with the schools down in Charles County? Are you opening, closing? Are you, I mean, doing online?
Yeah, we're going to be virtual for probably the entire school year, which is probably the right thing to do. I am not an advocate, especially working in healthcare, of putting parents who feel uncomfortable to make them send their children to school. But with that said, there's got to be a much better quality of education than they had during the immediate part after the shutdown. Just plopping them in front of K through 12 just doesn't work. It has to be more interactive. I don't want any child to graduate from Charles County Public Schools without feeling like they can go out and compete at any college. And that is our goal, making sure that our children can compete in the workforce if they so choose to be craftspeople, or they want to be, PhD candidates, or whatever they want to do with their life. I want to make sure that they have a solid foundation. And that is the heart of community building, because eventually, we're all going to be old and we're going to need someone to take care of us. And I don't want it to be someone who didn't have enough human interaction to understand the compassion that goes along with caring for the elderly and people who are maybe poverty stricken or infirmed in some sort of way. So that compassion part, I think, is missing when you're sitting a kid in front of a computer and they're just kind of clicking away. So human interaction, we can't keep this up forever. I understand the emergency part, but it's got to be, a hard stop date, and we got to kind of get back to life. Children are too impressionable just to have them sit in front of a screen, really.
Yeah. So we've actually got a question from the audience. Have you experienced any backlash from friends or family from being a conservative Republican?
Definitely not from my family, because I come from a long line of Republicans. But my friends, I live in Charleston, so I have a bunch of friends that kind of run the gamut. And all of them are very accepting of who I am. And I think that's really a testament to who I am as a person. I've been called some very fabulous names. I actually keep it in a book. So someday I'm going to write this memoir, and the first maybe 30 pages are going to be like half a pike of print of filthy names that I've been called. They're like, God, this is a real page turner, But I don't do that because I internalize any of that. I am very good with who I am. And I think that comes from a family who we're very good with who we are as people. So dirty names and vitriol, what can you do?
So the last several weeks or several months have been very charged. Obviously, big kicking off with, it didn't kick off. We obviously go back a couple of years, but of the George Floyd in Minnesota has touched off a real examination of race relations in the country. And some of it obviously has been framed in the idea that Republicans or whoever are racist. How do you deal with the political? How do you respond to sort of the political aspect of that?
So what I say is this: I don't think that any American, Black, white, Chinese, should come away from a police interaction dead, unless you had, shot at this police officer or had some sort of lethal interaction with them. I am fortunate here in Charles County. Our police force is very well trained, and they're very community minded, because they live here, right? And it's a small place, so you can only be so handsy with your next door neighbor. You know what I mean? Right. But in larger cities, I can see where this is an issue. I have 14 nephews, lots of friends, male friends, who are more touched by this than I am. I can say this: I think this was the perfect storm politically. It's a presidential election year. This horror of, Black men being killed by the police happened, and people were at home with nothing better to do, power watching Netflix. It's kind of a perfect storm that got us to this point. But as in all storms, there's some peace in this. This is a conversation that our nation has needed to have for a very long time. We've needed to get very honest with who we all are and how we move forward. We've been, kind of chugging along, kind of avoiding the elephant in the room. Now there's nowhere to go, and we have to face that elephant. It is naive to say that racism doesn't exist. It is absolutely naive. I say this to you as the chairman of a central committee where I myself have been called very nasty names by people who sit on the committee with me. I've been colored, I've been flavored, I've got a lot of stuff going on. But with that said, has it stopped me one bit? It is not something that would ever hold me back, because they're not complicit in my success. They're not complicit in my failure. I work really hard, and I deserve every single thing that I've earned in this lifetime, and probably a little bit more. Do I think if I were tall and blonde and blue-eyed and a size 2, would I be further in my career? Yes, because doctors like those kind of women. Make no mistake. But my circumstances are that I'm very well educated. I'm at the top of my field. I'm well respected. I work hard. So I've reaped the benefits of that. There are some people in my community who haven't been as fortunate as I have been. And they may find themselves in interactions with the police where they're either wrong or right, having to make a decision. Do I run? Do I try to free myself from this cop who's trying to wrestle me to the ground for whatever reason? And in those moments, everybody's really human. Adrenaline is flowing. They're trying to stop you from getting away. You're trying to get away. Bad things can happen in moments where everybody's not at their best. That's no excuse. Absolutely no excuse for the killing, the murder of anyone, black, white, or indifferent, in the hands of the police. But we've really got to take a look at how do we elevate people who have been forgotten or who have been missed by our economic prosperity. This was what's so amazing about Donald Trump's presidency. He had a way of distributing wealth to every corner. There's no denying that Black people were doing much, much better pre-COVID in America than we had ever done before. I mean, jobs where you couldn't go anywhere without seeing help wanted, apply here, interviews on Tuesday. We were doing so well, and everybody was kind of benefiting. So we were doing a lot, but there was still that elephant in the room. So now we're here. And there are a lot of ways to go about it. And I'll tell you now, looting, burning, destruction of property, overtaking cities is not the way. It's never been the way. You find more power and peace than you ever will in a race fist. Than you ever will.
If you have one piece of advice for the president on how to move forward with this, during pandemic, post George Floyd, what would you tell him?
I would tell the president to listen more, talk less, listen more. Right, and get off the social media. But I would say this: sometimes, how you have a friend and you hurt that friend's feelings really bad for whatever reason, right? And they're just kind of heartfelt about it. Sometimes you can say I'm sorry till you're blue in the face and they still are in their feelings. All you have to do is sit back and let them talk to you and express how they feel. Express, why my nephew is fearful when he's in New York City just visiting. And he's like, I just want to get in, get out, do my thing. I don't want to stay long enough for me to get caught up in anything. He's just as much as American as I am. I go to New York City and I'm like, woohoo, I'm here, let's shop. My experience as an American is different. And we have to be cognizant of that. There are places, let's just call it what it is, that are not brother friendly. There are absolute places that are not brother friendly. I benefit from being a Black woman. I benefit from being a Black woman who grew up with a bunch of Jewish people. So my existence is very, very different. And what I value is a little bit different. It doesn't make it better. It doesn't make it worse. It just makes it different. It's about time that we really start valuing the differences. It's what makes America great.
I really love that you said that. So I am Jewish. And just the conversations we've been having in our household is Jewish people and Black people go through very similar experiences in terms of discrimination. Unfortunately, it's a lot easier to tell if somebody's Black than if they're Jewish, unless they're walking around with tzitzit. And
right.
The two communities can really do so much together because we have this experience of taking an awful situation, discrimination, and learning from it and saying, you know what, and just like you were saying of I'm not going to let that stop my success. I'm not going to let that stop me from moving forward, you know? And I think
Well,
so much to be learned there.
right. And that's the thing, forward momentum. I will tell you, I'm a big legacy person. So I think Mark may have been on the email that I sent out shortly after being elected to the chair of the BRC. And I talked a lot about standing on the legacy of the people who came before me. You know, as a Jewish person, you get that. I mean, everything is legacy. And it's the same thing for the African American community. You know, I said this to a friend over the weekend when we were talking about this very same thing. And he's a white gentleman that lives in Wacomico. And he said to me, I couldn't imagine being you. I said, I can't imagine being you, you know, but here's the thing. Do you think that my great great grandfather would have ever thought that I would be who I am, that I would be as free and have as much liberty to be the best person that I could possibly be? Do you think that somewhere up in heaven, he's looking down going, that's my girl, you know, give it to him. That's my girl. I said, and then conversely, I would not dare judge you by the actions of your ancestors. You have no control over that. Right. There's nothing that you can do to make that better, to make it worse. We are here and we need forward momentum. We should never forget what happened. Like, we should not be tearing down our history, right? We should definitely not be tearing down our history. But there's an appropriate place for certain things. And I would say this. We have to learn to move forward. A lot of people, for a lot of political reasons, like to stay stagnant, right? As long as we can keep the Black community mad about slavery and Jim Crow and where's our reparations, then we can always say it was the Republicans who did that. And we're Democrats. Come over here with us and we'll use your anger and stick it to them. When really, it's not healthy from a psychological standpoint. As a race of people, we can't remain stagnant. We have to take the next step. We have to keep moving forward. Do not forget, but always be moving forward. And I think that's the lesson coming out of this for a lot of people who are, you know, not on the fringe ends of either side, but your mainstream people are saying, okay, listen, you're right. There was a lot of wrong done. We're going to have to push forward and set some new history, set some new rules. And I think that's really what's going to come out of this. I really do. I'm prayerful, at least, that that's what comes out of it.
Yeah, absolutely.
That's really sad. You just changing the subject a little bit. You're a healthcare professional. When we were talking before, that you had some prior exposure. Now, exposure is the wrong word, I think. But,
yeah, don't say exposure.
Exposure to pandemics. No. Let me rephrase that.
Pandemic.
But
yeah, I've worked through a couple of pandemics, and I'd have to say that COVID is my favorite pandemic. And
I was struck when you said that, and I was hoping you would elaborate on that.
So yeah, COVID is my favorite pandemic because, you know, medicine is highly regulated. And for people who don't really have a lot of experience in healthcare, you may go to for your annual physical, or God forbid you sprain ankle or something and end up in the hospital. But almost everything that we do comes with that much regulation, and it changes all of the time. I can say that COVID has had more government intervention than the HIV epidemic, you know, AIDS, H1N1, you know, the bird flu combined. You know, we have never had, from local all the way to the national level, government intervention in every aspect of our life because of a health emergency. Mm-hmm. So this pandemic is very interesting for a lot of reasons. What we're doing now, we had maybe like a month or so where we only saw maybe 10% of our patients who had COVID symptoms, who were what we call COVID suspect. And now we're starting to see maybe 20 or 30%. It's starting to pick up a little bit. But here's the caveat. Most people can't tell the difference between bad allergies, which, you know, it's Maryland, right? Bad allergies, the common cold, flu A or flu B, or COVID. And as we go running toward flu season, this is going to be the challenge for a lot of people. So some people will think, oh, I just have a bad cold, I'm going to ride it out. And then they're going to end up in the hospital. And there'll be other people who say, you know, I coughed 3 times, I'm on my way, you know, I want to get checked out. And it's just a simple allergy. But this is the challenge for us in healthcare. One, we have to keep ourselves healthy enough to help out. And two, we have to put together a plan that allows us the opportunity to take care of people who are ill without infecting everyone else. So I work in Montgomery County in a heavily Latino area, and they live very closely together. They have extended family homes, or grandma and aunts and uncles, and everyone lives in the same home. So when one of those persons gets sick, it's a wrap. It's a wrap. The whole household is sick. So there are lots of rumors about what can help you with COVID. There's hot soup. No, not hot soup. Cold soup. No, not cold soup. Ice cream, not ice cream. Shaved ice. I mean, it's running the gamut.
I read kimchi yesterday prevents COVID.
Mm-hmm. Spicy foods, lots of spice, habanero peppers. But my best advice to them is to make sure that you take your multivitamin, wash your hands, wear your mask, and take vitamin D. Lots and lots of vitamin D. And that's not just for COVID, but that's going to help you with the common cold. It's going to help you with flu A and flu B. And we're just really prayerful that we're going to get a handle on this vaccine-wise before flu season really kind of wallops us. We've been really lucky. Maybe the last 3 to 4 years, flu season has been very, very light. And that's not to make light of the people who lost their lives. We had a couple of children in Montgomery County who died last year from flu. But as flu goes, we don't get forever with a nice flu season. And we're hoping that this isn't the flu season that's going to have everybody knocking on our doors going, oh, I'm dying of COVID, and it's really just the flu, which is deadly as well. I mean, people die from flu every single year.
What about, because I'm curious, is so many people as flu season approaches going to get their flu shots, are people going to be less inclined to get a flu shot because they don't want to go into the medical centers to get them?
I can tell you, people are calling me now, making appointments for a flu shot. They are like, oh no, girl, I've done probably in the last month upwards of 250 annual physicals. People are coming in, they want to make sure everything's okay. They want to know, when is the flu shot coming? And the strains of the flu that the flu vaccine is made for, we don't get any of that until September. Mm-hmm. And then in September, you'll get a call from your doctor's office, or usually a text message to say, hey, we got the flu. You're going to make an appointment. Not this year. People are already lining up, sleeve roll. They're like, right here. I'll take one right here, because it's scary. At Tdap as well. And that helps with whooping cough and that kind of thing. We have so many migrant people in the area where I work in Montgomery County, and they're like, I need whatever you got to prevent this. Give me 2 flu shots, a Tdap. They want everything that I have just to try to escape it a a little bit.
I thought I was going to be like, can you just mail it to me and I'll do it myself?
Now, this may be slightly off message. I full disclosure, I get the flu shot every year. I encourage everybody else to do that. And yet I'm always struck by the statistics that show that it's not effective for, depending on the year, a significant number of people. And I guess I'm going to turn to you as the medical person nearby as to what do you tell people who are reluctant to do that when they know when there is a certain percentage for whom it's not effective?
Well, here's 2 things. So again, the flu shot, the flu vaccine, is only good for the strains that are the most popular. Right. And they base that on information from the previous flu season. So again, we've had 3 previous really good seasons, and that usually doesn't happen the 4th time. So they're kind of scrambling, saying, we might want to consider a little, like a Chinese menu, a little from column A, a little from column B, and come up with this vaccine. Well, if you're unfortunate and catch column D, you're going to get walloped, and there's no 2 ways about that. But what I say to people is, don't die, because it will kill you. Make no mistake. Young, rich, black, white, it will kill you. Now, some people say, I don't want it because it hurts. I don't want it because, I heard that it's some kind of zombie apocalypse, situation. I've heard all kind of war stories. The one guy said he gave him the chicken pox. People have all of these reasons for not doing it. And when I tell them, I don't want you to die, and I say that very gravely, 100% of my job is to make sure that you survive. So I need you to get this flu shot. And if you don't want it, I'm going to have to document in your medical chart that you refused. And that's usually when they go, well, wait a minute, don't be hasty. Let's rethink this thing, But it is, especially in densely populated areas, you would be absolutely foolish not to, especially vaccinate your children. And I know anti-vaxxers are going to come after me, but 2 kids last year in my community in Montgomery County died from flu. Wholly preventable. And we can't continue at that clip. If we've learned nothing from COVID, it's to take your healthcare a bit more seriously, just a bit. It doesn't have to be, you don't have to be one of the people who show up at my office at 6:30 knowing doggone well I don't open till 10 and just hang in the hallway until I get there, right? We have those people. But you do need to be very
hopefully
cautious.
Not too many congregating together, right?
You're 6 feet
No,
apart.
we have those, the
6
red
feet
dots.
apart. Okay, that's good.
Yeah, we have the red dots on the carpet from property management with these big red dots out, And our patient lobby is still closed because I can't guarantee that you can stay 6 feet apart. So we have this marvelously complex logistical dance that we do with our patients to make sure that they never cross each other's paths. And that when we bring them into the office, they go immediately to their exam room and they stay in their exam room for everything. If we're drawing their blood, we come to them. Doctor comes to them. My medical assistants come to them. My administrative staff comes to them. And then when we escort them out, they go all of the way out of the building. So we do that 4 or 5 days a week, maybe 75, 80 times. And it works like a beautiful dance. Now, my staff, people laugh at us because we wear Tyvek suits, but knock wood, not one COVID, not one employee down with COVID. So we do take our protection very seriously because we do COVID testing and we try to help as many people as we can. But there are some people who are not taking it seriously at all. I mean, they're like, that's not going to happen to me. No, I would never get sick. And if I got sick, I'm strong enough to fight it off. And I said, would you willing to bet your life?
Right.
Are you willing to bet your life? Because that's what you're doing. And if you're a parent, are you willing to bet your child's life?
And of course, the challenge is we all have interactions and are surrounded by people who are even more vulnerable than us. So that's
for sure.
And that's an additional consideration of you don't want to be the person who spread it to somebody else.
Yep.
It's interesting for me because I'm asthmatic and this is a terrible time of year for people with asthma because of the high heat. And so, I have to wear the face covering when I'm out and about and grocery shopping and that kind of thing. But my office again is in Montgomery County, so I wear the mask unless I'm in my office by myself. But I'm opening a new office in Salisbury, Wacomico. So I, travel to the shore and I get to the shore and there's like nobody with a mask. They're out there living their best lives. It's like I show up with a mask on and they're looking at me cross-eyed. They're like, what, you got it? And I'm like, no, I don't have it, but I don't want to get it. Everybody put a mask on. So they kind of see me and go, oh God, here she comes. Find the mask in my pocket. So different communities have responded differently, I guess, based on their COVID numbers. But in Montgomery County, people are definitely starting to take it a little bit more seriously because you would be hard pressed to know someone who didn't know someone who had a COVID experience. So I think, I don't want to say it's selfish, but I would say it's almost selfish not to do it, not to wear the mask. Yeah.
Yeah, Nicole, I'm a little worried about your commute. You're talking about Salisbury too? That's a long, Charles County, Salisbury, Tacoma Park. Sounds like you're going to be putting a lot of miles on your car.
I asked my doctor for a jetpack. Can I get like a jetpack and fly across? Thank God the toll is lower on the Bay Bridge, but I have a tremendous staff and I like to work. How some people say, I work for a living. I work because I love it. I work and then I come home and work some more. It's just my thing. It makes me feel productive. And I would like to say that it's a cure to my adult onset ADHD to keep myself busy. But it's a bunch of fun opening up a new medical practice. It's kind of like, building a house and then you get to see it finished and you're going, aha, it's wonderful. And then I get to walk away and find another place, which will probably be maybe Laurel is one of the places I'm looking at because the population is burgeoning there and they're going to get a new micro hospital. And I think that's super cool. There are lots of medical things that are happening in Maryland that are tremendous, absolutely tremendous. Maryland is on the cutting edge of a lot of things, and I'm very proud of this state for that.
Well, we'll have to have you back on sometime to talk about what's happening with Maryland healthcare, and
Mhm.
obviously we're the home to Johns Hopkins and lots
Yes.
of great resources. But thank you very much for being on the show. Thank you, Jackie, for co-hosting this, and be sure to follow us on both on YouTube, where we have all the videos from our past direct lines, and also follow us on Facebook.
And
Thank
follow
you.
the BRC as well.
And follow the BRC as well.
Thank you. Thank you. Thanks for having me, guys.